Hello, my name is Lindsay Rafferty, and this is my capstone presentation for Nebraska Methodist College. My topic is shaken baby syndrome in Nebraska, a preventable tragedy. I chose this topic because I would like to work in maternal care in some form, ideally supporting women and families throughout their pregnancy, childbirth, and postpartum period to help ensure healthy outcomes for both mom and baby. I am deeply passionate about women's health and well-being. Nationally, about 1,300 cases of shaken baby syndrome occur each year. And between 2010 and 2016, Nebraska alone reported 11 infant deaths linked to shaken baby syndrome, with rates as high as 7.45 cases per 100,000 in Sarpy County. It is known that 1 in 4 children will die from shaken baby syndrome, and 80% of survivors will suffer lifelong disabilities. While any caregiver can be at risk, there are contributing factors that are more likely to lead to this devastating tragedy. Lack of education, parents not understanding the dangers of shaken baby syndrome, and not having adequate coping strategies. Also, specifically to Nebraska, there is a lack of healthcare accessibility, lack of support for new parents, and Nebraska has been deemed as a mental health desert. Nebraska also faces a childcare crisis, lack of quality and affordable childcare. At the University of Lincoln, a full year of tuition and fees is cheaper than 1 year of infant care. There also are common risk factors associated with child abuse. While there are no specific common factors to shaken baby syndrome, it does fall under the same umbrella of risk factors with child abuse. This includes substance abuse, parents of a young age, history of family violence, poverty, lack of education, male caretakers, and babysitters. Resource availability for parents and caretakers. Nebraska launched the Safe Babies campaign, a statewide initiative aimed at reducing instances of shaken baby syndrome through conservation and education. Currently, 96% of Nebraska's hospitals participate in this campaign, which provides a 5-step prevention plan to over 26,000 new parents annually. This campaign also includes training for nurses who work with infants under 1 year of age and promotes patient educational resources such as 1, 2, 3, Don't Shake Me. Jenny Edmondson Hospital established a Shaken Baby Task Force in 1997. This task force provides free educational materials to schools, hospitals, and organizations throughout the Omaha metro area. Omaha hospitals also help develop personalized crying plans with their healthcare teams to prepare for and manage the stress associated with infant crying. Jenny Edmondson's Shaken Baby Task Force also provides a 24-hour helpline that is a resource created to support parents and caregivers struggling with infants crying, stress, or frustration, key factors that can contribute to Shaken Baby syndrome. This confidential line connects callers with trained professionals who offer guidance, emotional support, and coping strategies during moments of crisis. By providing immediate access to help, this helpline plays a crucial role in preventing impulsive reactions like shaking, especially among overwhelmed or isolated caregivers. There also is the Purple Crying Program, which is another key initiative aimed at preventing Shaken Baby syndrome by teaching caregivers about normal infant crying patterns and how to respond safely. This evidence-based program helps caregivers understand that excess crying is a normal developmental phase, not a sign of something being wrong with the baby or their parenting. By reshaping expectations and promoting healthy responses, the Purple Crying Program reduces frustration and helps prevent Shaken Baby syndrome through awareness, education, and early intervention. Proposal number 1, Nurse-Family Partnership. While Nebraska has made great progress in addressing Shaken Baby syndrome through its Safe Babies campaign and related initiatives, the state could continue to prosper by expanding the Nurse-Family Partnership Program, which has shown success in New York, Colorado, Tennessee, California, Louisiana, and the Netherlands. This nurse-led visitation program focuses on first-time low-income mothers. NFP provides personalized education and support not only during pregnancy, but also during early childhood years. This program focuses on addressing parental stress, lack of knowledge about infant crying, and appropriate coping strategies. By incorporating NFP into Nebraska's existing Safe Babies campaign and early childhood initiative, the state can reach vulnerable families in their homes and begin safe caregiving practices prior to the birth of the child. This approach would not only reduce the incidence of Shaken Baby syndrome, but also improve broader maternal and child health outcomes, including reduced child maltreatment and enhanced family stability. A study that was done by Miller and the Nurse-Family Partnership Program study, the program totaled an approximate $1.55 billion, averaging about $8,742 per family served. The initiative was funded federally through the Maternal, Infant, and Early Childhood Home Visiting Program under the Division of Public Health and accounted for roughly 1/4 of the department's overall budget. However, when factoring in the savings generated by reducing families' reliance on programs like temporary assistance for needy families, food stamps, and Medicaid, this program actually saved an estimated $1.45 billion. These savings are substantial, given that the public assistance programs can cost annually up to $3 billion. And so it creates a really great opportunity for Nebraska. While Nebraska does have a state statute that requires all birthing hospitals to provide parents with information about Shaken Baby syndrome, as well as normal infant crying and healthy coping strategies, there was a study that was piloted in New York by Diaz et al. And this program really took that program even further. And so In the western part of New York State, a successful standardized nurse-delivered education program added an extra layer of accountability by engaging parents more directly. Parents received a brief intervention that included a leaflet, an 8-minute video, and a signed statement acknowledging their understanding of the dangers of shaking an infant. This program resulted in a 47% reduction in the incidence of shaken baby syndrome and or abusive head trauma, making it one of the first large multi-hospital trials to demonstrate a significant prevention impact. While parents in Nebraska are currently required to sign a document acknowledging they reviewed materials, the New York model enhanced this approach by involving nurses directly in the education and requiring a signed statement confirming the understanding of the dangers of shaken baby syndrome, as well as providing follow-up calls to reinforce key information. And Diaz et al. Also evaluated the effectiveness of this program on actual abusive head trauma cases. It was conducted over 5.5 years, and the study showed that the region's 8 counties average of abusive head trauma decreased from 41.5 to 22.2 cases per 100,000 live births, which is a 47% reduction. This significant decline was cross-referenced with statewide data from the Commonwealth of Pennsylvania, which showed no comparable change in the abusive head trauma rates, further supporting the program's positive impact. My first educated citizen reflective individual really aligned with my presentation about shaken baby syndrome because it did take place in the neonatal intensive care unit and some time that I had spent there. So through my NICU experience, I developed critical thinking and assessment skills for recognizing subtle signs of distress in nonverbal patients. This is really directly applicable to identifying signs of abuse or caregiver stress that could potentially lead to shaken baby syndrome. Engaging with parents in daily care routines also mirrors how we as nurses must involve families in conversations about normal infant crying patterns and safe coping strategies. This experience in the NICU really showed my ability to notice those subtle cues and have early interventions, which is a critical skill for recognizing signs of child abuse and advocating for infants who really can't speak for themselves. Involving and educating parents mirrors how nurses can teach caregivers about infant crying patterns and safe coping strategies to prevent shaken baby syndrome. For my second educated citizen reflective individual, I wanted to share an experience that I had while taking care of a hospice patient. I had the pleasure of taking care of a 102-year-old patient who was receiving hospice. And I learned to approach patient care holistically by treating the entire family, not just the patient. This perspective is vital when addressing root causes of shaken baby syndrome, such as caregiver exhaustion, lack of support, or unmet mental health needs. While this patient was older, they were just as vulnerable, and their caregivers were under an immense amount of stress as well. And so this really aligned with my project. And my experience emphasized treating the whole family, not just the patient. This is a key in prevention because it involves education, supporting, and addressing caregiver stress. This experience shows my compassion for the different stages of life, which extend into recognizing caregiver struggles and connecting them with community resources that they may need before anything tragic happens. While I truly believe that effective communication has been a part of every experience I have had while in nursing school, I did have two experiences that I shared in my Educated Citizen that included a conversation with a patient who had gestational diabetes while I was shadowing a diabetic educator about meeting a patient where they are at in order to really get better outcomes for the patient. And then also, I shared a time that I had a patient on a ventilator and how myself and the nurse that I was working side by side with, how we were able to communicate with a patient who was unable to communicate with us in a traditional way, but was under an immense amount of stress. So both of my experiences really highlight the importance of patient-centered, adaptable communication. How it aligns with shaken baby syndrome is that it's crucial that we need to provide clear, non-judgmental education to meet parents at their literacy level and respect any cultural differences. This will help build trust and make patients feel safe asking for help before the stress may become overwhelming. This really underlined my ability to adapt communication to different literacy levels, cultures, different stressors, really what's needed when teaching overwhelmed parents and how to handle an infant who is unconsolable and with their crying. It also demonstrates how clear, non-judgmental communication will help build trust and open the door for really tough conversations to be had. For my Educated Citizen Change Agent Level 1, I shared about my experiences with diverse populations that included some behavioral health experiences that I had at Jenny Edmondson Hospital, as well as a experience with Down Syndrome Alliance. And so I learned to provide care that is sensitive to diverse backgrounds and meet their unique needs. How this aligns with shaken baby syndrome is that this education must be culturally responsive to ensure that families truly understand safe caregiving practices, regardless of language, their socioeconomic status, or family structure. Overall, these experiences really highlight my commitment to understanding diverse family dynamics and stressors that can increase shaken baby syndrome risk, such as young parents, lack of family support, language barriers. All of this is going to reinforce the need to tailor shaken baby syndrome education to be culturally sensitive and, more importantly, accessible for all families. My final Educated Citizen Change Agent Level 2 was about my experience with the Abide organization in North Central Omaha for their Better Together Run 5K. Working with Abide allowed me to see the impact of connecting families with local resources. As a future nurse, I can extend shaken baby syndrome prevention beyond the hospital by collaborating with schools, clinics, and community programs to share healthy coping resources, as well as promoting legislative efforts and addressing gaps in mental health care and child care support. It is important to have dedication to community outreach and partnerships, which is key for spreading shaken baby syndrome prevention beyond the hospital through organizations, events, and of course, political advocacy. Demonstrating how someone can empower communities with resources, normalizing conversations about infant safety and caregiver well-being. Preventing shaken baby syndrome requires more than clinical skills. It demands critical thinking, compassion, cultural awareness, effective communication, and community engagement. My experiences, as outlined in our Educated Citizen portfolio, have prepared me to be a dedicated advocate for the safety and well-being of mothers, babies, and families. By combining education, early recognition of risk, family-centered care, and collaboration with community resources, I hope to empower caregivers, reduce preventable infant tragedies, and create a supportive environment where families never feel alone. As I grow in my nursing career, I am committed to being a voice for our most vulnerable patients and an agent for positive change in our community.